As we talk about the endodermal derivatives, we have got one question here asking us about the vaginal epithelium. And this is one controversial question, since different authors will be giving different answers. But since most of the authors are resorting to the endoderm of urogenital sinus, we'll keep this answer here and mention that though the genitourinary system is chiefly developing from intermediate mesoderm, but the lower part of genitourinary tube, which will include the urinary bladder, urethra, and the vagina, they are coming from the endoderm, and that too from the endoderm of gut tube. In fact, what happens is the gut tube itself is from the endoderm. In its upper part, it is contributing to respiratory tube, hence the respiratory tube along with gut tube is from endoderm. And in the lower part, the gut tube contributes to the lower part of genitourinary tube, hence the urinary bladder, urethra, and the vagina. They are also from endoderm of the gut tube. It will become evident when we look at a diagram, draw a diagram, but for the time being, we will keep our answer as choice number B. Endoderm of urogenital sinus, which itself comes from the lower part of the gut tube. That is the hindgut basically. And here we are looking from the side view of a developing baby, showing the gut tube, and gut tube itself giving us the respiratory tube in the foregut region and lower part of genitourinary tube in the hindgut region. But first, let us mark the three parts of the gut tube. And if we are talking about the foregut hair or the midgut hair and even the hindgut hair, their epithelium is from the endoderm. Now we notice that in the foregut there is a bud coming, the lung bud, and this is one which is going to give us trachea, bronchus, lungs, or the respiratory tube. So respiratory tube is developing from the gut tube, that is the foregut, and there will be one septum developing here which is called as tracheoesophageal septum. Trachea in front, esophagus on the posterior side. Similarly, there will be one urorectal septum developing in the hindgut region, called so because in front of that is urinary system, genital system, and posteriorly is the rectum. Hence, urorectal septum. So posteriorly is rectum. What is anterior? Anterior you have urogenital sinus, and urogenital sinus contributing to urinary bladder, urethra, and the lower vagina. So urinary bladder is coming from the endoderm of the urogenital sinus, and so is the lower vagina. That is why we took our answer as endoderm of urogenital sinus. Now you notice this is the hindgut region, and from the apex of urinary bladder, one diverticulum is coming towards the umbilical cord, becoming a content of the umbilical cord. It is called allantois, and allantois is a hindgut diverticulum, becoming a content of the umbilical cord. There is one more diverticulum which is actually coming from the midgut, the Vitelline duct. So Vitelline duct, which is a midgut diverticulum, is also a content of umbilical cord, and these ducts must be obliterated. If they are persisting, there can be problems. Persistence of Vitelline duct can result in a fecal fistula, the fecal matter coming to umbilicus, and persistence of the allantoic duct can result in urinary fistula, the urine coming to the umbilicus. These all anomalies we'll be discussing in the abdomen region. But the point is, may it be the Vitelline duct or the allantoid duct, they are all lined by endoderm. Now you will see endoderm giving some more derivatives, like in the lateral wall of the foregut, the pharynx region, we have got pharyngeal pouches, and these pharyngeal pouches developing in the lateral wall of the pharynx, the foregut, will give some glands, thymus gland, the parathyroid gland, which are obviously endodermal in origin. Plus at the junction of foregut and midgut, two glands are developing, the liver and pancreas, and these liver and pancreas developing at the junction of the foregut and midgut are again endodermal in origin. And this is the diagram which we are going to draw now ourselves. So here we draw the gut tube, and we understand that it will have some epithelium. That epithelium of the gut tube is coming from the endoderm. Now, if the epithelium is coming from the endoderm, what about the muscles? If you say muscles of the gut tube, then they are smooth muscles. And we know the smooth muscles of the gut tube or respiratory tube, they were coming from the lateral plate mesoderm, ventral, visceral, lateral plate mesoderm. So when we are talking about the gut tube, we are actually talking about epithelium and the glands coming from the endoderm. Now this gut tube has three components: the foregut, then you have the midgut, and then we have the hindgut. And in the foregut, one septum was developing. We are calling it as tracheo-esophageal septum, since in front of that is trachea developing, behind is the esophagus. And then there is one septum in the hindgut region as well, the urorectal septum. But before we talk about this urorectal septum in the hindgut, let us first focus upon the foregut. The tracheo-esophageal septum separating trachea anterior, esophagus posterior, sometime it can have deficiency, leading to tracheo-esophageal fistula, and that can be dangerous. When you are talking about the tracheo-esophageal fistula, why is it dangerous? In front of tracheo-esophageal septum is developing the lungs, and the lungs were actually having acid aspiration. But why the lungs are having acid aspiration? See, whenever there is a tracheo-esophageal communication because of deficiency in tracheo-esophageal septum, there can be aspiration of the gastric acid into the esophagus, to the trachea, bronchus, and the lungs, and that can be detrimental to the baby hair. Then we have learnt in the proximal part of the gut tube there is a pharynx, and the lateral wall of the pharynx we have pharyngeal pouches. These pharyngeal pouches, which develop in the lateral wall of the pharynx, they are giving us some glands like the thymus gland, parathyroid gland, especially their parenchyma. But then a question came, what about the connective tissue of the thymus? Now be careful if they say connective tissue, because we have learnt the head and neck mesenchyme is secondary mesenchyme coming from the neural crest cell. So it is a neural crest cell which will form the connective tissue in this region, and the thymus connective tissue is from neural crest cell, derived mesenchyme, secondary mesenchyme. So there are two questions. Question number one is asking, thymus gland developed from. There you have to mention endoderm of the pharyngeal pouches. But if there is a specification, connective tissue of thymus developed from, then you say neural crest cell derived secondary mesenchyme. Now from the foregut, we have seen two more glands developing. At the junction of foregut midgut, we have liver and pancreas. So may it be the liver or may it be the pancreas. Their parenchyma is from the endoderm of the foregut mostly, and small contribution from the midgut because they are at the junction of foregut and midgut. So we have discussed four glands coming from the foregut. Then in the lower part of the hindgut develops a region which is called as cloaca, and in the cloaca region of the hindgut develops one septum which is called urorectal septum. Since in front is the urogenital sinus and posteriorly is the rectum, hence the name is urorectal septum. At the tip of urorectal septum develops the perineal body, and this perineal body in the adult is going to separate the vaginal opening anteriorly and anal opening posteriorly. As we understand, it is the rectum which continues as the anus, and urogenital sinus contributes to lower vagina. Actually, urogenital sinus, you can remember three derivatives. As we have mentioned earlier, it is giving us urinary bladder and the urethra and the lower vagina. As you mentioned, urinary bladder and the urethra and the lower vagina, only the epithelium, not the muscles. Why? What about the muscles? See, the muscles like the detrusor muscle of urinary bladder is a smooth muscle and must be coming from intermediate mesoderm. The smooth muscles of genitourinary system come from intermediate mesoderm. So what is the hindgut giving? Only the epithelium. Like we had a question, vaginal epithelium developed from, and we say endoderm of urogenital sinus. Actually, there are three questions on vagina. Question number one, where is smooth muscle of vagina developing from? If you say smooth muscle of vagina, then intermediate mesoderm. Question number two, skeletal muscle of vagina developed from. Skeletal muscle in entire body developed from only paraxial mesoderm. All the skeletal muscles in our body develop from paraxial mesoderm, a statement of Gray's Anatomy. And question number three, where is vaginal epithelium from? Vaginal epithelium is obviously from endoderm of urogenital sinus.